Okay, guys, so we're going to go ahead and begin this module on diabetes and public health and take a look at this particular chronic disease, which of course is largely impacted by obesity, nutrition, and physical inactivity. So we're going to be addressing those factors as we take a look more deeply at this disease. But let's first take a look at what this disease is. So diabetes mellitus is a group of metabolic diseases characterized by an inability to produce sufficient insulin or to use it properly. So we're going to take a look at two different primary types of diabetes. But the basic idea is it's a group of diseases, and it's going to be characterized by the way in which it has or uses insulin. The result is what we call hyperglycemia. Insulin is produced in the pancreas by B cells through a pancreas hormone called glucagon, and these are through beta cells primarily produce insulin. It has utilization of glucose. It can also utilize glucose in muscle, fat, and liver. So what happens is that your body will produce insulin through the pancreas hormone in the beta cells, and then the insulin helps to utilize glucose at the level of the muscle, fat, or liver cells. So these three cells will then upload glucose into their cells for use of energy. So hyperglycemia has a risk then for developing several different factors, and hypoglycemia by definition is high concentration of blood glucose. It has a risk for developing microvascular diseases, which includes retinopathy and nephropathy, macrovascular diseases, which we'll talk about as well, and neuropathy that can be both peripheral and autonomic. It's the seventh leading cause of death, and this may be underreported. And this is largely because when we consider causes of death, we often consider the primary cause of death as the cause of death, and that's what goes into the statistics. But we do believe that 35 to 40% of people with diabetes who died did not have diabetes listed on their death certificate. They may, and if it was listed as an underlying condition, which sometimes they consider that as the actual cause in the cause of death certificates. But we're estimating around 35 to 40% of people who've died had diabetes, and either they didn't know it or it wasn't listed. There's also epidemic proportions in the U.S., and we believe that this is largely because of an increase in sedentary lifestyle and poor diet, which leads to an increase in overweight and obesity. And we're going to see that obesity is one of the primary underlying causes of the development of diabetes. We also see an increase in high-risk ethnic populations. So there are certain ethnic populations that are higher risk for diabetes. Now, some of it is questioning whether this is because of living in our environment or if it is a true genetic component. And we largely think it has much more to do with the environment and the disparities that already are consistent with these populations as it relates to healthy behaviors in the environment and communities that are lacking in these populations. And also the aging of the population can also be part of the reason that we're seeing these epidemic proportions. Diabetes has one of the largest portions of economic burden, and this is largely because of long-term complications and hospitalizations. And so let's take a little bit of a look. The Center for Disease Control and Prevention published just this year, just a few months ago, the National Diabetes Statistics Report. They do this every few years. So this is fresh off the press data, the most recent data from 2018. And the crude estimates are that about 34.2 million Americans have diabetes, which represents about 10.5% of the entire population. 34.1 million adults aged 18 or older had diabetes, which when you look at just the adults, that's about 13% of the population. So we do have some those younger than 18, but that represents a much smaller proportion of the population that has diabetes. So we're really looking at many of these adults having something more related to type 2 diabetes, and we'll talk about that in a second. 7.3 million adults age 18 or older are also not aware of or did not report diabetes. We consider this undiagnosed diabetes because clinical tests indicate that they are diabetic, but they are either unaware or they didn't disclose it. That represents about 2.8% of the entire U.S. population. When we look at adults only, it represents about 21.4% of adults with diabetes are undiagnosed. And so there is a problem in that about 10.5% of the population has diabetes, but we have about another large percentage of those that are undiagnosed diabetics. And so we really need to be better able at educating the public on what is conducive to diabetes and getting tested so that we can care for individuals. And we'll talk about that a little bit more. The economic cost for 2017, total direct and indirect cost was about $327 billion. This increased from $188 billion in 2012 to $237 billion in 2017 for direct costs. Indirect costs also increased in that time period from $73 billion to $90 billion. So both direct and indirect costs are increasing across the time point, so it's not getting better, it's getting worse. And in particular, as a reminder, direct cost is the medical care that's needed for diabetes, and indirect cost is related to disability or loss of productivity because of premature death. One of the things that you'll notice with this disease is the direct cost. Typically, we see higher costs with chronic disease from an indirect in many cases than a direct, but diabetes is a very costly disease from a medical standpoint, from direct medical costs, because of the long-term complications and hospitalizations that occur with diabetes. And excess medical costs per person with diabetes also increased. In 2012, the excess medical costs for an individual with diabetes was about $8,400. That went up to about $1,000, a little over $1,000 to $9,600 in 2017. So that's what it's costing individuals to care for themselves with diabetes, excess medical costs, typically in the year. And so what we're looking at here is a very costly disease. And this is because diabetes is not just treating the hyperglycemia, but it's treating all the complications that come from it. Our body is meant to use glucose for energy, but it is not meant for it to be in excess. We don't want it to just be floating around. And part of the problem with diabetes is it floats around in our system, causing damage to many of our organ systems. And we'll take a look at all of that as we go forward. So let's take a look at the most recent data. This is again 2016, 2018 is some of our most recent data that we have that was taken from that 2020 report. And this is just kind of showing you, this is crude prevalence of disease, and we've already went through many of these points here when we looked at total population, including the undiagnosed diabetes. About 13% of the adult population, this is in adults, has diabetes. And when we look at age here, some of the things that I want us to take a look at is, obviously as one ages, we see a higher percentage of individuals being diagnosed with diabetes or having diabetes even if undiagnosed. So the risk of diabetes increases with age. We also see here from a diagnosed standpoint, undiagnosed and total, that men slightly more likely than women, or slightly higher percentages of these kind of things. And when we look at race and ethnicity, we're going to see our Black non-Hispanic and Asian non-Hispanic being at a higher risk than white non-Hispanic as we look at those numbers. And this is true for diagnosed. When we look at undiagnosed, it flips a little bit, and Asian non-Hispanics have a higher percentage of undiagnosed compared to Black non-Hispanics. And that could be largely because of Asian culture and their decisions to use traditional medicine. And so when we look at the data total, we see that Black non-Hispanic have higher proportions of diabetes, followed by Asian non-Hispanic and Hispanics very close, and then white non-Hispanics. So there are similar disparities that we've seen in previous numbers. When we look at estimated number of adults 18 or older in numbers, this is in millions. You can kind of see these numbers that we've already talked about. And again, you're seeing just some of those same sort of ideas here in terms of population risk. But I just wanted you to kind of see the number in millions. It's about 26.8 million people with diagnosed diabetes in 2018. 7.3 undiagnosed, which leaves us about 34.1 million people with diagnosed diabetes. I'm sorry, with diabetes living in our country. That's a significant amount of our population. When we look at trends in age-adjusted prevalence of diabetes, we can see that total diabetes, diagnosed diabetes have been increasing over time. So we're seeing that this is not decreasing, it's actually getting worse. And this should make sense as we look at some of the other data that we've already seen as sort of a review in terms of the risk factors for diabetes. The only one that has sort of leveled off is undiagnosed diabetes. And I think this is largely due to an increase in efforts to get tested for your glucose levels, having increased screenings of glucose free at health clinics, work sites, schools, at PCP's offices. So the population as a whole being a little bit more educated on the importance of getting fasting blood glucose so that they can recognize diabetes a little bit sooner. And so I think that undiagnosed is getting better because people are more aware of and getting screened and tested more frequently for this. But as in total, more individuals are being diagnosed with these conditions, with the condition of diabetes. This is looking at age-adjusted estimate prevalence by age or race and ethnicity again, but it also is separating it by sex. And one of the things that we can see here as we look at some of the other races, such as American Indian, Alaska Native, we actually see that they have some of the highest prevalence of diagnosed diabetes, both in men and women, higher than even Black non-Hispanic. Some of the data I had showed you earlier didn't include that, so I wanted to include this slide to show you that this is actually one of the highest groups. And then we see in total, when you add total, Black non-Hispanic is higher than Hispanic or Asian populations, but we are seeing some differences in males and females. In particular, we're seeing white non-Hispanic, Hispanic, and Asian populations have more males being diagnosed than females, and then in Black non-Hispanic and American Indian, Alaska Native, it's just a little bit more females, although it's probably about the same for both men and women. So again, from this slide, I wanted to highlight that American Indian, Alaska Native has the highest. Then we're going to see total, when we look at total, Black non-Hispanic, Hispanic, and Asian populations being pretty similar. And then when you look at it separated by sex, we're seeing that Black non-Hispanic, American Indian, Alaska Native is pretty similar between males and females. White non-Hispanic, Hispanic, and Asian non-Hispanic, slightly more males than females in these situations. And then when we look at education level, this data is a little bit older, so I'm not so much concerned about you knowing percentages, but just to understand that as education increases, educational level increases, we have less people being diagnosed with diabetes. And this should make sense a little bit as we think about the individuals with more education tending to have be more likely to eat a healthier diet and to be physically active, which helps to control obesity and decrease the risk of these other diseases. So I just wanted to kind of point that out here as well. This one is looking at age-adjusted prevalence of diagnosed diabetes, and it's adding in all of those sources that we've looked at before. It does it for total and men and women, and actually is giving you percentages here. Again, I'm not too concerned about you knowing the overall percentages, but just again to understand those differences, and of course that as age or as education level increases, we see a reduction in those being diagnosed with diabetes.